Interventional radiology is really the youngest medical specialty right now, and it's the marriage of the pictures we take, whether it's X-ray, MRI, CT, or ultrasound, and then using those pictures to perform procedures in patients. And in general, we're the most minimally invasive specialty, where most of the operations we're doing through just pinholes in the skin. Interventional radiologists have really pioneered a lot of advances in treatment of arterial disease and venous disease or vascular disease in general. A lot of patients who come in to our practice are really concerned about the cosmetics of their veins, how they look. For most of them, they really do have a medical problem. Once you talk to them, they may have some swelling, they may have some cramps. And so there's a large overlap. And for many of these patients, the cosmetic appearance, the spider veins, the ropey varicose veins, are just a sign that there's something else we need to look at underneath and get that treated first before we take care of the cosmetic side. The typical patient who comes to our practice may complain of heavy legs, tired legs. Most of the patients may complain of or have the concern of restless legs at night. Their partner or their spouse may complain of them kicking them at night because they can't quite get comfortable. When they come to our practice, they get a complete evaluation of their legs. We evaluate their veins to see if there's vein reflux that may need to be treated. We also evaluate their arteries completely to make sure their symptoms aren't due to arterial disease. As far as treating varicose veins in our practice, we do full and complete treatments, in that we can offer ablation of the veins, including radiofrequency ablation, or we also offer vascular glue to close veins, which is for many patients faster and easier. We perform sclerotherapy injections, where we put a medicine into the vein to cause it to close down. We can use that for large ropey veins. We also use it for cosmetic spider veins. And then for patients who may need it, we can perform microphlebectomies, where we take small portions of the vein out through the skin. We do that in the office through just pinholes or tiny incisions in the skin that we don't even use sutures for. On the arterial side, we can travel through the arteries and use a balloon or stent to open up the arteries to improve blood flow. You know, our goal with treatment of venous disease is for the patient to have essentially no downtime, other than having to come to our office. For most of the treatments we perform, the patient gets a Band-Aid for where we entered the vein. We'll put a stocking on, and they generally walk out about 20 to 30 minutes after their procedure. Downtime is minimal. Most patients may have a little bit of tenderness over the veins we treat, but patients can go back to work the same day. They can go back to work the next day. A lot of our other patients are coming in just for a consult with, what can you do for me, Dr. Doherty? And those are the leg pain patients. They don't know why they have leg pain, they just know their legs aren't healthy. And so those are much longer, much more involved, very detailed visits where we perform a lot of patient education so that they can connect what we found on the imaging studies, whether it's an ultrasound or CT, to what's going on with them. Then we can take them and show them how we can help them with our procedures.